Hello and welcome to this episode. For today's talk show, we have a very special guest with us. It's Dr. Sanira. She is doing her Cornea Fellowship from Aravind Madurai, and she lost just 5 marks from attaining her gold medal. So she has lots to say with regards to how to approach DNB, how to really take it forward. She's going to give us lots of practical ideas, tips, and tricks. So let's see what Sanira has to say. So, Sanira, over to you.
Hello friends, thanks Pranesh for this elaborate introduction. Here I am to introduce me and share few experience from my side. First of all, hearty congratulations for choosing one of the finest branch in surgery, that's ophthalmology. So here I am, Dr. Sanira, and I finished my DNB from Aravind Eye Hospital Tirunelveli in October 2018. Currently, I am working as a Cornea Fellow in Aravind Eye Hospital Madurai. So friends, in the start of your residency, you're really confused. So many questions pop in your mind, as in, should I get all the books? Should I read the reference books too? How should I read every day? So on and so forth. In the beginning, you might just be doing observation sitting next to your seniors in order to know how things go in ophthalmology. But at the same time, if your mind doesn't know, your eyes won't see it. So you should start reading right from day one. So what all should you buy? I would feel that everyone must buy a copy of Parsons and Kansky in the beginning of your residency. So you should start reading symptomatology from Parsons. It also gives standard definitions and pearls in clinical examination beautifully. You can also revise A.K. Khurana that you read in our UG days. Kansky could be your master book. Each day, whatever new sign that you have seen, may it be keratic precipitates, may it be a corneal ulcer with a hypopyon, a lid tumor, BRVO, or a diabetic retinopathy, or a glaucomatous optic cupping, please go back home, give some time to read about it, and discuss with your mentors, colleagues, and teachers. In the first year, you should always try gaining knowledge as much as possible. Initial 2 years of your residency, you can really spend some time reading in reference books too. And also, it's important to take the systematic notes. Your notes should consist of flowcharts and concise description of particular topic that you are reading, because revising the same will be a doable task right before your exams. When you're attending any class, there should be an active participation from your side. Keep your doubts ready and get those clarified there at that. So this is one snap wherein I have showed I had a habit of putting labels in my notes so that the revising thing becomes very quick and easier. There is no rush that you go through. As you progress in your residency, responsibilities like camp activities, OPDs, surgeries increase. But in spite of all these things, reading is really essential. Exam preparation should always be at the back of your mind. Reading articles is a good habit which you should inculcate right from beginning. DOS articles were really useful in my experience. Another important thing for DNBs is to go through all the exam papers from last 10 years. DNB exam question papers are available on the official website, that is www.natboard.edu.in. And prepare a question bank. Herein I have shown an example of my question bank wherein I had divided those topics according to the subject. So for example, retina, I had some n number of questions. For glaucoma, some questions. And you can actually write the page number from which book you have read or particular article that you have referred to, so that revising is very easy. More you revise, it's better for you to represent yourself. So most of us get specialty postings in rotation. So my suggestion would be to plan your specialty posting in appropriate manner. There are few to-dos that you're supposed to complete within that month. So pertaining to that specialty, you should inquire about what all cases are commonly asked for exam. So plan your study accordingly. Get those cases, present them to your teachers, have a discussion about it, and remember it till your practical exam. Here, when we are working in a institute doing DNB, we are really privileged to have technicians to carry out all the investigations. But as a private practitioner, later on, we should be able to carry out all these investigations on our own and also, importantly, interpret them appropriately. So, for example, in cornea posting, you should focus on op scan, specular microscopy, confocal microscopy, pentacam, keratometry. In case of glaucoma posting, reading OCT, ONH, HFA 24-2, 10-2, 30-2, GDX, Octopus, etc. In case of retina and uvea posting, OCT macula, FFA, ICGA, OCT angio, ICGA, B-scan, ERG, VEP are few important points you should really focus upon. A basic knowledge of reading radiographic images, for example, X-rays, CT scans, and MRI, is very essential in case of neuro-ophthalm and orbit specialty postings. At the end of your pediatric and strabismus posting, you should be able to carry out strabismus examination with prism cover bar test confidently by yourself. In addition to that, you should focus upon learning how diplopia charting and Hess charting is done and how to interpret them. As a part of institute, we have optometrists to help us with refraction. But uh, refraction and retinoscopy is the bread and butter in private practice. So any chance to learn that, it shouldn't be missed, and you should focus on retinoscopy and refraction equally well. In the specialty posting, you can also plan your set of questions to be done for every week. Right before you enter your third year, one major target is to complete your thesis. The process should be as genuine as possible in order to have approval from DNB without any hassle. In that, I would suggest you to proofread it again and again and also check for plagiarism. At the end of each year, formative assessment test, that is FAT, is one thing and one important opportunity that gives a practice for you to write an exam and also give a model practical exam. You shouldn't get stressed for it. Take it as an opportunity to basically know where you stand and how you can improve upon each subject. So for primary DNBs, there would be 2 exams at the end of first year and second year. And for secondary DNBs, it will be just an exam at the end of first year. Writing FICO exam is also one good thing, wherein you can actually practice your optics and refraction and basic sciences right in the first year, as you are always fresh from your basic sciences stuff from your entrance. You should also get involved in the research activities, may it be a paper publication or a presentation in a clinical CME or a conferences. So coming to the final focus, that's how to write the DNB exam. The golden rule being attempt all 10 questions. We are supposed to write 10 questions for 10 marks each in 180 minutes, which also means we can spend 15 to 17 minutes for one question. Give 1 minute to read the question thoroughly, understand what is actually expected out of you. May it be a case, so understand that clinical case and actually what is asked, what we are supposed to write, know the fact, plan the basic structure of your answer, and start writing your exam paper. Diagrams and flowcharts can aid you represent yourself in a most quick and efficient way. Give some practice for drawing diagrams in standard color codings given in Kansky right from beginning. Also practice the ray diagrams from optics and refraction. If your study is organized right from beginning, the things won't be difficult in last minutes. The fourth paper in DNB final exam is based upon advances in the field. HV is one book which I would suggest you to refer to. Currently, HV volume 14 is being published last year, and you should also keep a track of the next volume being published and also give a look at it. Reading DOS articles from last 5 years to know the recent advances is also one good idea for the fourth paper. Lastly, I would like to say a few points about DNB practical exam. So there are actually a period of 2 to 3 months between your theory exams and practical. So especially after theory exam, try and take cases present to each other amongst your colleagues, your friends, your teachers, and practice your presenting skills. Get the proformas ready for the commonly asked cases, commonly kept cases in each specialty. Get your smallest doubt clarified. Take help from your mentors. You can refine your skills like this. Reading FAQ by Dr. Venkatesh Prajna and a book by Dr. Namrata Sharma is really helpful for last minute revision. So in the practical exam, what we are supposed to do is take 4 long cases, for each of which we get 20 minutes. So that 20 minutes you should utilize for taking down the history. If you are traveling to another state for giving exam, it also means that you have to take a help from a translator and get the history and start examining right from taking vision until fundus examination and write up the whole case in 20 minutes alone. It is not that difficult as it sounds so, but if you were really sincere enough throughout your residency, things aren't very difficult. You just have to believe in yourself and keep calm and confident. The general rule being examiners are always right. Do not argue with them. Admit if there is some mistake or some finding that has been missed by you. Sometimes they just want to hear that. You have to really fight for your pass even when some examiners are really discouraging you. Leading your viva in the direction where you are really comfortable and express more confidently is really essential. And last but not the least, learning is a lifetime process. So enjoy each bit of it and wish you all very good luck. Over to you, Pranesh.
Right.
I'll stop sharing the screen.
Yeah, that's fine. Okay. Great. That was an awesome, way to just take things forward right from start till the end, from the day one of your exams to the day last before your exams. So we'll just try to summarize, and let me just share my screen so that I'll just say what are the points Sanira just shared, so that we'll make things more easier and consolidate for the audience. So let me just share my screen. Okay. Okay, so here is what Sanir has already told us. I'm just going to try to make it very short. The first and foremost is exam preparation starts from day one. That's what she meant. So it's not about the last 2 months or last 3 months. It's all about those entire 3 years of your residency, and it all starts from day one of your exams. And know the questions beforehand. It's always good to know what questions are being asked in the exams. So always prepare your own question bank, your own handwritten question bank, topic wise, and that will help you a lot. And to add my suggestion, you can always you can put X's after the question, so how many times they have been asked previously, so that you can have a frequently asked question, so that you can focus on those questions more than the other questions. Notes are always helpful. Of course, they're controversial. Some people prefer to prepare their own notes. Some don't want to. It's up to you. But it's an investment worthwhile. And once you have a good set of notes, like topic-wise, that will be a very good thing for last-minute revision. And preparing your own proforma is also another important thing, because in the viva, it's all about presenting the cases in the best way possible. So preferably self-written proformas, I think it's a must for anyone. And you have HV Nima is one book which you have a series of books. In fact, they have like 11, 12, 13, 14. Like Sanira mentions, like series 14 or the edition 14 is going to be the latest one. And DOS articles are a great important tool, because DOS article kind of simplifies all the, all the questions. So there are a few questions, few answers which you can't find in the textbooks, you can find in DOS articles. So what I would suggest is, you see the numbers 2, 3, 4 and 5. Okay, you can compile this entire block into one book. What I mean is, if you take a book called Retina, you can write all the FAQs, all the questions asked. So you can prepare a question bank of Retina. You can have your own self-written notes in that book. You can also have the lecture notes of Retina, case discussions happening in your hospitals. And you can even take a printouts of the DAS articles You can paste it. So what you'll have is you will have a complete set of notes in each notebook, like retina, glaucoma. I think for the last minute revision, that will be of great help. And like she mentioned, ICO and FAT exams will really help help you to gauge yourselves, to assess yourself where you are standing. FAT exams for DNB guys, it's a must. You can't escape that. But ICO will be a very good addition, will be a very good way to assess yourself especially for the MS and DO candidates, where you don't have an annual exam or a self-assessment conducted by the board itself. And like she mentioned, discussion with friends is always important. And teaching, if you ask me, is the best way to learn. I think Sanira also might agree to that. You can always teach.
Yes, definitely.
Yeah, that's true. You can always teach your seniors, in fact, because what I feel is if you're a first year or a second year, you can teach basic sciences, anat, physio, and biochem to your seniors. You can even prepare a set of notes which would help them. And that will be a very good investment for you also. You can always make use of the notes later. And present cases whenever and wherever possible. I think it all boils down to presentation skills and communication skills as far as your viva is concerned. Whenever given a chance, be it in your postings or be it in your classes or in any conferences for that matter, presentation is the key. It's always the most essential thing. And coming to some elements during the exams, I think two most important things, it's all about, again, presentations in your paper. So diagrams are the key, flowcharts are the key, and as she mentioned, color coding is very important. Many of us forget that in the rush of the exams, but color coding is very important. And last but not the least, staying calm and composed and confident during viva is always essential. I think I've covered whatever Sanira has mentioned in a nutshell. So I got a few questions, Sanira. So first thing is, like, how much time should we spend per day to read? Like, is there any specific time you allotted per day?
I would just say the truth, because no one is perfect. So you cannot say actually that I read every day for 1 hour for all throughout my residency. It is not possible. There are some ups and downs. You are on call, you're having some night duties, you have some other stuff. So I would suggest is, if at all you come across some new concept in the whole day. I know that every patient you learn some new things, but eventually, right in the beginning, when you see any new concept or a new sign, or someone asks you any question, please don't go back and just postpone the things that you want to read. What you want to read, what you were asked to read, please finish it the same day itself, or at least in a day or two, because this will consolidate your clinical assessment and the corresponding theoretical knowledge for the same. If you just keep postponing things, then things will get piled up and it will be really difficult to finish it off lastly.
Okay,
so I would feel that you should read every day, but timings, I won't say that you have to read 1 hour at least or something, nothing like that.
Right. So ultimately, never let go a day wasted. Need to read something new every day. Okay. Actually, I know DNB guys read a lot. You have a lot of extensive references and resources to read. But if I were to ask, what is the one book that we can read for DNB? That is, you can keep as a master book, or you can rely on that book rather than like fishing for other books. If there is one book to read, what would you suggest? Is it going to be Zia Chowdhury, which has been a time-tested book, or the new edition of Payments, again, which people give some good reviews because it also has everything in one book? What is your suggestion would be?
So both books are really good. I haven't read the whole books completely, but I have read few topics from one book, few topics from the other. But I would feel that Zia Chowdhury would be a good book to select, to keep it as a master book and add the things from other books and articles to it. And lastly, you have to make it concise in a way that you're able to revise. So even if you have chosen already Payman as your master book, there is no harm, or Zia Chowdhury, there is no harm. Because unless and until you revise those things up and make it revisable at the end, the things aren't going to be really easy. So make it concise, don't let the things be scattered in all the forms. So let it be one thing that you can revise last. So I would feel that Zia would be a good book. Understanding is very good in it, given in a simple language, but you can always choose other also.
Right. Good. So the last question is, what would be one advice that you want to give to your juniors? If there is one advice, what would be it?
So what I feel is you should really work hard for anything in your life, but your work should be really smart. And if you do so, there is nothing that is impossible. So wish you all really good luck. And I would like to thank Pranesh for this opportunity and showing confidence in me to say this. Thanks, Pranesh.
Thank you. Thank you, Sanira. So I just want to end with this. Actually, we tried to work together and we wanted to give the best experience possible for the audience, because the best learning experience comes when you have something after, or some message to take after a lecture or a talk like this. So we thought we'll prepare a PDF, like a small booklet, an ebook, which consists of three important elements. First, what we'll do is we'll try to put in all the DNB questions, both topic wise and year wise, we'll put it. And second, we'll put in all the essential online resources, the link for DOS articles and the websites to get more questions. To quickly I'll just give you three important web resources. One is eOphtha. I think Sanira might agree. eOphtha has a lots and
Yes.
lots of resources with regards to DNBs, especially. They have a big collection of DNB questions. And another is ilearn.in. It is a recently made website by two young ophthalmologists. Brilliant website. You can always go and see that. The third will be iguru.org. It's a website prepared by US residents, and it has all very basic essential information for the first years to kickstart your ophthalmic career. So I think that ends with this edition of of inviting people and giving them a chance to display, to exhibit their talents and their knowledge. I think that has been a brilliant discussion so far, Sanira. So thank you so much. If you want to say something.
Yes, I just want to say thank you and wish you all really good luck.
Okay,
And DNB isn't that difficult. You can really do it.
that's great. So thank you, Sanira. Thanks a lot. I think the audience really might have benefited something out of this talk. Thank you so much.
Yes.
Thank you,
Thank
Sanira.
you. You have stopped recording?
Yeah, I have